What causes stuttering?
We have the neurodevelopmental conditions, which are also gaining popularity now because of the education that we are having. So we have autism, we have ADHD, we see a lot of language delays or even disorders in them. We have others who have other conditions like the Down syndrome, cerebral palsy, cleft lip or palate, where there's an opening in the mouth, the roof of the mouth or some parts of the lip.
Okay.
So for children, it's
girls, they are one than boys. Please, is that assertion true, or is just one of the myths that we are just believing in?
So someone would ask, does alphabets and numbers form part of the child's weight? Yes, it forms part of the child's weight, but is it functional? Because when you're hungry, you won't say A. A will not tell me that you are hungry, or B won't tell me that you are hungry. So is it a vocabulary? Yes, but is it a functional vocabulary? No, it's not.
This is another episode of The Heartbeat. When we say the heartbeat, you respond one heartbeat at a time. The Heartbeat is a platform where we have honest conversation about health, well-being, and lifestyle. Today's episode is a very important episode because it bothers a lot of homes, a lot of families, and it can cause a lot of stress in the home. Some even families fight over it. Because somebody says from your family, another person is from your family, or is your family that is your family that is it. Today we are going to have a discussion on what speech and language is all about, the delays in speech of kids and everything there in between, and what the duties of a speech and a language therapist is. So I have in a studio a speech and a language therapist who has been in the industry for some time, and she's doing amazingly well. So she's going to help us to digest into what goes into it, what parents should look out for, what a family should look out, what society should look out for, and what our hospitals should also do when it comes to the early childhood development, and also when a child cannot speak. What are some of the early developmental issues when it comes to speech and language? I'll let my guest introduce herself and we take it from there. Welcome, darling.
Thank you. Okay, so I am Emmanuella Osei Adjah, and I am a speech and language therapist.
Okay, Ella is a speech and a language therapist. Emmanuella, you know, being a speech and language therapist is not so common in Ghana and Africa where we find ourselves. What inspired you to become a speech and a language therapist?
Okay, so I've always wanted to work with children.
Okay.
It has always been a passion. I mean, anyone who knows me growing up knows that I love kids and I want to work with kids. So after secondary school, I had the opportunity to choose a field that I would pursue. And I wanted to be a pediatrician, but I guess my grades didn't move me towards that side. So I looked for other things I could do that would help me work with children. So I spoke to a pediatrician who advised me on different fields in the medical field. So I chanced on speech and language therapy. It looked good. So I decided to pursue it. And I mean, that's how I ended up there.
Okay. And how has the journey been so far? Inspiring, tedious, happy? How has it been?
It's been inspiring.
Okay.
It's sometimes tedious, sometimes sad, sometimes challenging, but in all, it's been worth the risk and the time.
Okay. When we say somebody is a speech and a language therapist, what does a person do?
Okay, so a speech and language therapist is a professional, and I must say, an allied health professional who assesses, diagnoses, treats, and manages people with communication and swallowing difficulty When I say
Communication and swallowing. Okay.
yes, so anyone across the lifespan, as early as 6 months,
Okay.
as old as 120,
Okay.
once your communication has been affected,
Okay.
you see a speech and language therapist to support you.
All right. That's a lot of work.
It is.
That's a lot of work because it means you work with babies and also the aged a lot.
Yes.
And also sometimes in between. But
the
mostly
youth
the babies
and
then the aged,
very old, yes.
the very old people. And that's the challenging part because the babies are not talking. So you have to
help you develop the speech. And then the older ones used to talk,
Yes.
but now have the challenges. So you have to help them to communicate now.
Whoa, that's a lot. Whoa. So if you just tune in, this is the Heartbeat. The Heartbeat is brought to us by Adenta Credit Union, 1115 Restaurant, the Thera Ghana Foundation, Salt Pal, Tulipa 369 Hair, and all our viewers who have been supporting us, commenting, sharing. We say thank you very much for making the Heartbeat thrive and progress. And keep sharing, keep commenting, and keep liking to let others also know about what we discuss, which borders on life, lifestyle, and also health. So, Ella, what is the most rewarding part of it when you're able to help somebody do what they couldn't do before?
So with speech and language therapy, the goal is communication, not necessarily spoken speech.
Okay.
So when I say communication, we have the nonverbal, like we know, and the verbal. Now, my goal in therapy is to help you communicate. So the person may not necessarily pick up spoken language, but the person may use other forms of communication. So like gestures, sign language, facial expressions, or even technology.
Okay.
So the whole goal is communication. So once my client is able to communicate, I mean, there are instances where we have a child who is nonverbal. We introduce a technology we often call AACs.
Okay.
And once the child is able to express using that gadget, I mean, the joy is just pure. There's nothing compared to it. That's seeing someone who was unable to communicate finally communicating, even if it's a single word. It's rewarding, very, very rewarding.
And I can see that it will bring a joy and fulfillment. That
exactly.
I mean, I've been able to improve somebody, move somebody from here to there, and you see it happening
a lot.
Okay, that's good. So, what are some of the things that delay speech in children? What are some of the signs we should look out for and all those things?
Okay, so for children, we see children who have speech and or language. So I say speech and or language because speech is different from language.
Okay.
So we can have someone who has a speech difficulty, someone who has a language difficulty, and someone who has a speech and language difficulty.
Okay.
Now, one we see is in children who are premature.
Okay.
So we know that in the third trimester, where a lot of attention is developed in the brain. So children who are not able to get to that particular point, we have auditory processing. So you need to hear before you can use spoken language. So if you have difficulty with your hearing, you are definitely going to have difficulty with your spoken communication. So we see it's there too. Then we see for children who have reduced language exposure.
Okay.
So we have the popular screen time debates where we have children who have prolonged screen time, sometimes as early as 3 months, and then the child is on the screen. It's not really about what the child is watching, but it's about the fact that the child is being deprived of social interaction. So by the time the child is 18 months, 24 months, that's 2 years, you see that the child probably has a lot of vocabulary, can say a lot of things, numbers, alphabets, sing some rhymes. But when it comes to basic communication, mommy, I'm hungry. I want food. I need water. I don't like this. Give me a toy. Give me this. You don't see it in them. So that's from language, lack of language exposure. Then we have the neurodevelopmental conditions, which are also gaining popularity now because of the education that we are having. So we have autism, we have ADHD, we see a lot of language delays or even disorders in them. We have others who have other conditions like the Down syndrome, cerebral palsy, cleft lip or palate, where there's an opening in the mouth, the roof of the mouth, or some parts of the lip. So for children, it's a combination of a lot of things. Are there specific causes? Like conditions like the neurodevelopmental, it's a brain development. But for the language exposure, as I said, if you are deprived of language, you can't use the language. So we are here in Ghana. We can't speak Chinese. Why? Because it's not in our environment. But if you pick a Ghanaian child and you take the child there, the child would pick up that language. Why? Because the environment had the language. So the language exposure to a child is very important for language acquisition and use.
Okay, so at which early age should a child be exposed to language?
As soon as you notice you are pregnant.
Okay.
You are
Say that again.
As soon as you notice you are pregnant, we advise you to start to speak to your child. So someone may argue, but the child doesn't know English, the child doesn't know tree. The child is able to recognize the voice. So you see videos where a father says hi, then you see the tummy, there's a kick, mommy does this, there's a difference. So the child has been able to recognize the voice. When the child is out in the world, when that voice is heard, he or she knows that, okay, this voice is familiar. This voice is familiar. So the moment you know you are pregnant, please be a talkative for that child.
Please, so this is from a speech and a language therapist, an allied health professional to all of us. So if you know that you are pregnant, the moment you get to know you are pregnant, start talking to your children. They would recognize the voice. And this is from somebody who has specialized in the area to us. Sometimes people think when people are talking, they're like, oh, you're doing something. What is this? The child cannot even, as she's saying, this is from a professional to all of us, that the moment you recognize you're pregnant, start speaking to the child. Say things that's why we say that you should talk to the child the way you want the child to respond to you. But if you say trash, sorry to use that word, the child will respond to trash. So let's be intentional to talk to the baby. So as soon as we realize that God has placed them in our womb, so that they will hear the voice and they will recognize it when they are born. Ella, what are some of the areas that we see that are the major stages, let's say from birth to 5? What do you really see?
Okay, so from birth to 5, by the time the child is 6 months, as early as 6 months, even 2 months, they begin to recognize sounds around them. So you have a baby in front of you. There's a loud noise, the baby turns. Daddy's voice, the baby turns. Or a caregiver, someone who spends most time with the child. The child would turn and then look around. They begin to recognize faces, smells, so familiar smells. They hear, they see, they even perceive mommy's smell, and there's looking around.
Kind of
looking for that's as early as 6 months. Now we begin to see babbling. So we have 2 kinds of babbling.
Okay.
Where there's one that is consistent. So you get the ba 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 da 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 da. That's consistent. By 9 months, we want to see a variety in the babbling. So like ba da ga. So there's a change in consonants, consistent. Now, by 1 year, we are looking out for at least 3 words.
Okay.
So we have mama, dada, or even a version that is available in their environment. So you get 1-year-olds calling their mommy honey, because that's what daddy calls
says,
mommy, or dear, because that's what they hear. So any word that is consistent in the environment, the child would produce. If the child is not exposed to any word at all, the child is not going to produce. It is, as we often say, garbage in, garbage out. What you expose the child to, the child will see. So if the child is exposed to screen, you get feedback from the screen. Now, by going to 2 years, the child is beginning to follow instructions. So give me maybe water. The child picks the water for you. Go and bring your shoe. The child goes to pick that. Now, whatever instruction the child will follow will be something the child is exposed to. If I meet a child and then I say, maybe I speak Ga in an instruction form, and the child doesn't follow, it doesn't mean the child doesn't know the instruction. It's most the language that is being exposed to. So you have to know what language is the child exposed to. Then you can say that, okay, he's doing this or he's not doing that. So the child follows instructions, begins to use variety of speech sounds, mostly what we call the labial. So the b, p, those simple sounds. In terms of intelligibility, so an unfamiliar person understanding a 2-year-old will be about 25%. So locally we say nanon shedante. So then they sometimes use 2-word phrases. So mommy food, I want, no, mommy yes. Then going to 3, they begin to expand the word. So maybe mommy, I want food, or mommy teacher, then it's like the rest of the sentence is lost.
Missing,
Yes, or they try to say maybe an older brother beats him or her. She'll try and then use 2, 3, 4 phrases. Now to an unfamiliar person, the speech will be about 50% intelligible. So there's still that room for nanon shedante here. Then when you are 4 years now, we are looking for about almost 100% intelligibility for unfamiliar people. And then by 5, your speech should be perfect, should I say. So whether I know you or not, when you speak, I should be able to understand what you say. As for, there may be some room for certain sounds, because certain sounds, complex sounds, may not be fully developed, but there's that ability for the child to try to produce it. But by 5, speech sounds are fine, child is engaging, talking about past things, trying to answer complex questions, make inferences. Why did this happen? Who did this? Talk about the past. Try to engage in stories. Try to even form their own stories. Ask more questions. Try and then use more than one language as well. And then with goals, with milestones, it's not one size fits it all. So you can have 2 1-year-olds, and the fact that the first 1-year-old is not probably saying 3 words doesn't mean that there's necessarily a language disorder. So we look at the environment. What is in the environment? So someone would ask, does alphabets and numbers form part of the child's weight? Yes, it forms part of the child's weight, but is it functional? Because when you're hungry, you won't say A. A will not tell me that you are hungry, or B won't tell me that you are hungry. So is it a vocabulary? Yes, but is it a functional vocabulary? No, it's not.
Ella, there's this saying that girls develop when it comes to speech and language than boys. This is like girls, they are one thing than boys. Please, is that assertion true, or is just one of the myths that we are just believing in?
So for many years, we saw that as a myth, but current research is actually showing that there is an increase in male population when it comes to late talking. However, that is not a getaway card to delay intervention.
Okay.
Whether male or female, once late talking is noticed, you have to look for intervention as soon as possible. There's nothing like because he is a male and it's normal.
Okay.
Yes.
Okay. I mean, if you're watching us, I hope you are learning. This is a lot of education for all of us. And as Ella had already explained, we need to be intentional about communicating to our children from the time that you realize you're pregnant. That's what she said. And please, let's be intentional about it. So, when parents walks in, what are some of the interventions that you do?
So depending on what you are presenting with, so the child is
The
presenting
delayed
with. Yes. So is it a delayed speech? Is it a delayed language? When we say delayed speech, we have different types. So we have the articulation difficulty. So, for example, let's say rabbits, and then the child says wabbits. So that's a wrong articulation. That's the R and the W. And then we have the phonological one. So maybe the child deletes certain sounds, like maybe cats, and the child says cat. Then there's no t sound. Or we have what's the popular one that we call front end. So like the k again, but the child says t. So instead of cat, we hear tat. So then that intervention would have to look at helping you to articulate well, to helping you to recognize the right sound, helping you to position the tongue well, and then the sound comes out perfectly. Then we have the CAS, that's the childhood apraxia of speech, which is no problem. It's no fault of the child actually. It's not because of a muscle weakness. It's motor planning, so it's from the brain. So you see that the child tries everything to do the right articulation, but he or she is unable to do it. So you see the grouping, you see the expressions trying to make the right sound, but the child is unable to. So there's a different intervention for that. So the assessment would help us identify that, okay, is there a speech problem? Yes. What kind of speech problem are we looking at? Then we can give the intervention.
You mentioned like positioning the tongue. What causes stammering, stuttering? The and what should parents seek to do? Because I mean, sometimes some of the kids too, as you say, they imitate. They go to school, they have a friend who is maybe stammering, and how they start talking, they also start imitating it. But there are some too that are just from early childhood thing. They are stuttering, they are just or stammering. If you realize that early stage, is there an intervention that can be done if a parent should seek help early?
Okay, so stammering is the same as stuttering. I think we have the American English and the US, so we have that variation. So stammering is simply a disruption in the flow of your speech.
Okay.
So it's also known as disfluency. So there's a flow with your speech. One, there's a breakage, a repetition, a prolongation. I would say the person is stammering. We often see it in kids developmentally. So it can actually be acquired post certain conditions for adults. But for children, we see it emergent by the age of 2 or between the ages of 2 and 4. For some children, it goes away by itself, especially for the females. This is not to throw shade on the boys. And then it persists after 4. So within that 2 to 4, we do what we call indirect therapy. So the therapy is for the parents and the caregivers of the child to make the environment suitable for the child to speak freely. We don't want to draw awareness, because stammering is not it's not a disease. It's not something that you should be worried about like this is the end of your life. No, it's not. So therapy is indirect. So we have the parents and the caregivers of the child. It goes through a therapy session on how to interact with the child, how to engage the child and support the child. So we look out for what kind of stammering are we seeing? Is it a prolongation? So we have the sorry, that's a prolongation. We have the repetition. I want. Then we have the even fillers. So you talk and you do it's a form of stammering, but it has been seen to be normal now. So it's not something that requires therapy. Yes. So we look at what kind of stammering is the child presenting with. Is there family history of stammering? Has it persisted? Is it growing worse over a period of time? Then a therapist comes in to provide therapy. But now the world is moving towards stammering freely. So whether you stammer or not, there isn't any judgment as compared to before, where you'd have to go through a lot of fluency shaping, talk like this, do like this. Now with therapy, those who stammer freely are actually stammering like most people anticipate the stammering. So he knows that maybe I have difficulty saying the S word. So if I want to say a word that starts with S, I'm going to look for another word I can say or act like I've forgotten what I want to say. Then maybe someone just fills in for you. Yes, but when they are given the chance to speak freely, they stammer less. So we try to use that approach as early as possible for the kids. No pressure. Speak the way you can speak. No spot on. Don't do it like this. It's not like this. Say it well. Open your mouth. Breathe well. No. Allow the child to speak freely.
Allow the child to speak freely. That is what Emmanuella is telling us, because sometimes the interjections also gets them confused.
Yes, you finish their sentences for them. There's no, says like no, it's not like this. No, it doesn't help at all.
Please allow the children to be free. Why? So that we would really know when they have that free space. That is when the speech and language therapist will know that truly the child needs a real intervention. But if you are there just filling in for them, the assessments will not be complete, and then the intervention will not really be good. So please, let's allow them, whether they are stammering or stuttering, that's whichever way we call it. Let them be free. Let them free themselves and say what they want to say, so that, because sometimes some parents, those interjections, children grow and they don't even want to talk in public because there's nobody to fill in for them. I've come across some teenage and you're talking with their mates and they will leave. And then they will tell you, oh, as for him, that's how he is. You later do one-on-one and you realize the person is stammering and it was just shying away from that. So from what our professional is saying, let's let them speak freely. We have this early development condition, just as you mentioned some of them, the autism and all that. How may autism affect a speech and language and also a social communication of a child?
Okay, so autism is a neurodevelopmental condition. One thing that autism affects is your ability to socially interact. As I said earlier, social interaction is important for language acquisition. However, we have autistic individuals who are speaking. So the presence of autism is not equal to the presence of a speech delay. The fact that you have autism doesn't mean you would have communication problems. We have individuals who communicate perfectly, but they are autistic. So let's keep that in mind, that sometimes you wouldn't have. But in the case where someone is autistic and has a speech or a language disorder, it's often a language disorder, because then the person has to understand and use the language. Yes, so it often affects language,
Okay.
not the speech,
Speech.
because for speech it's more of your sound.
Mhm.
But for language, what you have to say, how you have to say it, when you have to say it, understanding the use of expressions and gestures. We have individuals who would just speak, whether you are willing to speak or not. He has to speak. No understanding of social rules. So I speak, you speak, we engage, we look at each other, we use our gestures. With them, most of the time, you would see maybe no emotion. They say it as it has to be. They are not able to understand idioms, proverbs, anything you say that is not as raw as it is, they wouldn't often understand it. So that's where you get their difficulty, often with the use and understanding of language rather than
Would
the
you say
speech.
that every child who have a speech delay must have a hearing assessment?
For a speech delay, I'd say yes, to rule out the possibility.
Okay.
So for you to produce the sound B, if you can't hear and you look at my lips, you would also move your lips B. But there's a difference between B and P, but they are all produced at the same place.
Okay.
So if you are relying only on what you can see my lips do and not hearing the difference between the sounds, you would most likely make a mistake. So for speech sounds, I would definitely require you to do a hearing assessment. Let's rule that out. It may not be necessary, but just to make sure that we are not working when there's a hearing problem. Because if you are not hearing, then whatever it is that I'm doing, you are not getting it.
Yeah.
So you have to do the hearing assessment. Then we can go ahead.
So will I say that when it comes to the speech and the language therapy profession, aside pediatrician, you work with audiology?
Yes.
And then which other developments?
Occupational
Occupational
therapists,
therapists.
physiotherapists when we have the cerebral palsy kit,
Okay.
ENT specialists,
Okay.
for the hearing care. Some kids with Down syndrome have
Okay.
difficulties with their hearing, the eustachian tube being shortened, or consistent cold fluids in the ear. So we work with them to adenoid hypertrophy. So for all for ENT specialists. Now we are even beginning to work with respiratory therapists for the older patients, because you need to have a good respiratory system to speak. It's your breathing that powers your voice.
Yeah.
So if you have difficulty breathing, we'll see it in your voice. So there's no need working tirelessly on getting your voice when the powerhouse, as we call it, is compromised.
Yes. I was just about coming there, working with the agent or somebody who might have suffered an unfortunate accident, and because of that, they are not able to talk, or they are having a speech or a language issues. What are some of the incidents that you had come across that you are working with? In what had happened to them and all that? So what are some of the cases that you are working with?
Okay, so for we call them our mothers and our fathers. They probably have a stroke or have had a stroke.
Okay.
It could be immediate or past, so some a year ago or maybe 2 weeks ago, a week ago. Others would have had a traumatic brain injury, so like the accidents. More young people now with the accidents
and
even
strokes.
stroke now.
I was about saying that. And
You
cardiac
see
related
someone
thing.
as young as 28 and
The person has a stroke.
hi, I had a stroke 2 weeks ago, and I think now we see more younger people with strokes than the older people with the strokes.
And it's becoming it's alarming.
Very alarming. And you just look at the history, the heart condition, there's high cholesterol, there's always something, and you look at the age and you are amazed.
The non-communicable
happening?
diseases.
What is happening? So we have the stroke, we have the TBI, we have the neurogenic conditions, so the Parkinson's, Alzheimer's, a little bit of stammering, but that is post-stroke. So we have adults who have never stammered in their life, but post-stroke, they present with a stammering. Yes. And sometimes even complications of surgery. So the person has no condition. I mean, he went in for a surgery, complications on the table, came back and then has difficulty communicating. I once had a patient from gynae ward. So I was called gynae, what's our surgery complication. So for older people, it can be anything at all. Others actually sleep and wake up and there's a problem with their voice. Yes, we have pastors, musicians, politicians. So for adults, once the communication is impaired, then there's swallowing. So most of the aged with stroke or who have had a stroke often come with muscle weakness. So you see it in their inability to swallow or pain or difficulty swallowing. Then we have those who have been on a tube for a long time or the trachea. So the tracheostomy.
tracheostomy.
Yes, so it's a variety. Once communication is impaired, you are with me.
Wow, that is a lot of work. Sometimes some of these things can become frustrating for parents, and there are instances that they want to give up. How have you been able to achieve and work with them to encourage them not to give up, and the assurance? How does it happen? Because it could be very frustrating. I mean, with my foundation, the Tarragona Foundation, we had come across with people who previously had done a thyroidectomy in the previous 8 times and they are not talking, or they have a hoarseness in their voice. And at first, when they used to do the partial thyroidectomy, now the other side too has nodules, and you have to convince them to take it out. Even that is not easy. How has it been for you?
So with my mothers and fathers, as I like to call them, we often, before you lay everything out, we educate the family. See, most of the time, I believe that with the older clients, when they have that support system, recovery is much better. Educating the family is often my priority. So when I meet a person for the first time, and especially on the ward where everything is fresh, and then you have different professionals coming to ask you questions, poking, what happened, what did you do, and then all that. The first thing I do is to educate the family that, hey, this is a condition. We thank God that he or she is alive. That is important. We thank God that he or she is alive. He or she is going to have some difficulties, and it is our responsibility to support the person. The person who is sick is realizing that, okay, I used to do this, I used to do that, I'm unable to do it. Especially the mothers, maybe they used to shout on the kids, come here, do this, and then now it's that same kid who is feeding you, maybe doing it with an attitude, trying to change you. So there's a lot on the patient, understanding the new me, the new challenges. Maybe he or she used to eat fufu, banku, and then now there's a tube.
Solids.
So I start with the family that we have to work together to get your mom or your dad to a particular place. But if you are going to constantly drill, ask questions, why can't you do this, stand up, do this, it doesn't help. Then with the patients, we encourage them that we thank God you are alive. That is the important thing. And these are the interventions in place to support you. This is not a done deal, you are done, nothing can be done. No, there are lots of things that can be done, but we also need your participation. So in my clinic, I've had adults who had difficulties with their speech, and then now they are much better.
And this is from our speech and language therapist, Emmanuella. Ella, today's discussion has been an eye-opener to a lot of, it's to me personally and also to a lot of viewers, because speech and language, there isn't much out there. It's now that the education is ongoing, and having you here has been a privilege. Thank you very much for coming. This is the heartbeat. When we say the heartbeat, you respond one heartbeat at a time. Heartbeat is a platform where we talk about health, well-being, and lifestyle, and everything in between that makes life comfortable and makes living it worthwhile. I have been your host, Dr. Nanadra Kuniju. The Heartbeat is brought to us by 1115 Restaurant, Adenta Credit Union, The Salt Pal, Tulipa 369 Hair, and the Tharagana Foundation, and all of you are viewers who make it happen. Keep commenting. If you need the services of Ella, please put your details down there. We'll link you up with her and she will be there to help you. If you need anything concerning speech and language therapy that a response to, put it right down in the comment and keep sharing and keep commenting so that others will also learn just as you have learned. Thank you very much and see you again in our next episode. Thank you for coming, Ella.
Thank you for having me.